So in the case of an injury, it's usually something that it's not really necessarily that you're prepared for. It's something that you're in an emergent situation and it's got to be done, and that's really your only choice. So those are easy to figure out. You have somebody gets in a car crash, they got something wrong with their cornea, they need a transplant, and you do that sort of on an emergent or semi-urgent basis. Same thing would go, say, if you had a chemical injury. Let's say um, you get Drano in your eye and it destroys the cornea. Okay. That's something where we really don't have an option to treat the tissue that's already there because it becomes scarred or not usable. Um, there are other situations, especially infectious situations, where treating the infection sometimes will also save the cornea. So if you ever have a corneal infection, say they're most common with contact lens wearers that sleep in their contact lenses. So if a patient sleeps in their contact lenses, they get a corneal ulcer. The quicker they can get into the ophthalmologist and get treated for the infection, the less damage that infection will do to the cornea. And there maybe you can save their cornea without having to do a cornea transplant. There are some genetic diseases, specifically one called keratoconus, which is very common worldwide, where we've now got the technology to stop the progression of the keratoconus before it gets to the point where it needs a transplant. Historically, honestly, as recently as 10 years ago, we didn't have a lot of treatments for keratoconus. So those patients, if their keratoconus progressed over time, ultimately they would need a cornea transplant. Now we have a procedure called cross-linking that can arrest the progress of cross-linking, or I'm sorry, of keratoconus. And by arresting that process, we're able to avoid the need for a cornea transplant. So in those situations, it really is just depends on how much damage occurs from whatever process it is. Some of the disorders, such as genetic disease of the cornea, though, it's more a long-term process. And so your ophthalmologist is going to tell you along the way, hey, you've got this disorder. We'll use Fuchs dystrophy again because that's the most common problem. You've got this disorder called Fuchs dystrophy. It's inherited. You can't change the fact that you have this disease. At some point in your life, you may need to have a cornea transplant. And then you monitor that over time. There's really no way to reverse it. There's really no way to prevent it or change it, but you monitor over time until it gets to the point where it starts to interfere with the patient's vision to the point that they can no longer take care of themselves.